Hi everyone, I'm Jerrynine Nalus from grade 12 St. Anselm of Canterbury. I'm here to talk about how to prevent COVID-19. I will share you some tips to prevent the coronavirus. What to do to keep yourself and others safe from COVID-19. First, maintain at least a 1 meter distance between yourself and others to reduce your risk of infection when they cough, sneeze, or speak. Maintain an even greater distance between yourself and others when indoors. Second, make wearing a mask. This is a normal part of being around other people. The appropriate use of wearing a mask is always show the colored one, and you can only wear one mask at least 5 hours, then dispose it properly. Here are the basics of how to wear a mask. First, clean your hands before you put your mask on, as well as before and after you take it off, and after you touch it at any time. Second, make sure it covers both your nose, mouth, and chin. Third, when you take off a mask, store it in a clean plastic bag, and every day either wash it if it's a fabric mask or dispose of a medical mask in a trash bin. How to make your environment safer. Avoid the creases, spaces that are close, crowded, or involve close contact. Outbreaks have been reported in restaurants, choir practices, fitness classes, nightclubs, offices, and places of worship where people have gathered. Often in crowded indoor settings where they talk loudly, shout, breathe heavily, or sing. The risks of getting COVID-19 are higher in crowded and inadequately ventilated spaces where infected people spend long periods of time together in close proximity. These environments are where the virus appears to spread by respiratory droplets or aerosols more efficiently. So taking precaution is even more important. Meet people outside. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without outdoor air coming in. Don't forget the basics of good hygiene. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. This eliminates germs including viruses that may be on your hands. Avoid touching your eyes, nose, and mouth. Hand touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and infect you. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissues immediately into closed bin and wash your hands. By following good respiratory hygiene, you protect the people around you from viruses, which cause colds, flu, and COVID-19. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as door handles, faucets, and phone screen. What are you going to do if you feel unwell? Know the full range of symptoms of COVID-19. The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Other symptoms that are less common and may affect some patients include loss of taste or smell, aches and pains, headache, sore throat, nasal congestion, red eyes, diarrhea, or a skin rash. Stay at home and self-isolate even if you have minor symptoms such as cough, headache, mild fever until you recover. Call your healthcare provider or hotline for advice. Have someone bring you supplies. If you need to leave your house or have someone near you, wear a medical mask to avoid infecting others. If you have a fever, cough, and difficulty breathing, seek medical attention immediately. Call by the telephone first. If you can Follow the direction of your local health authority. Keep up to date on the latest information from trusted sources such as WHO or WHO as your local and national health authorities. Local and national authorities and public health units are best placed to advise on what people in your area should be doing to protect themselves. That's all for today. Thank you for listening. God bless us all.